Felicity is pleased to present you with our very first webinar focusing upon the pandemic's impact on mental health and its effects. So, hi, I'm Karun Matthew, and I will be your moderator for this session today. And we request all of you, include our audiences here today, to send in your questions at any point in time in the chat box. And they will be answered towards the end by our panelists. We will also be conducting a webinar every week. So please subscribe and follow our social media pages and send in your suggestions and ideas, which would help us develop our model for the future webinars as well. We would like to thank you all, especially our panelists, for taking time out today to join us and share your thoughts and your expertise on the topic. And of course, to everyone who's watching this live, I hope you and your loved ones are safe and well, and thank you for joining us. So before we start, I'd like to first introduce our panelists. I'd like to start with Ms. Niharika Khale. She's completed her MSc in Clinical Health Psychology from the University of Strathclyde in the UK. She's equipped with therapy tools such as RECBT, motivational interviewing, behavioral modification, NLP, among many others. Ms. Niharika has experience in working with clients having anxiety, mood disruptions, stress, trauma, grief, and bereavement. She also has experience working with families of and individuals suffering from chronic life-threatening diseases and illnesses such as diabetes, hypertension, stroke, cognitive impairment, and cancer. Along with this, she also conducts therapy for individuals, family, and group for everyday issues and problems like stress, relationship issues, procrastination, anger, etc. Welcome, Ms. Niharika, to this webinar. Our next and second panelist is Dr. Sapna Zarwal, who is a former school director, served as head of Moms Believe, is a renowned trainer, educator, psychologist, with an exceptional interest over the last 19 years towards making a difference in the field of child and adult counseling. Healing and education for children, and above all, learning or teaching learners with learning disability. She's a dedicated child psychologist with ample experience as an educator, innovator, and a teacher by heart. She was the ex-founder director of Multi-Disability Center Deep Potential Kids, which has been awarded the Excellence Award in the year 2015-2016 for the most promising clinic in Delhi. She has the credit of organizing more than 500 training sessions, workshops, and conferences in various topics, to name a few: classroom management, communication skills, attitude, emotional skills, stress management, relationship counseling, anger management, depression, and these are just a few. So, welcome, Dr. Sapna, to this session. Our third panelist is Dr. Charan Teja Koganti, who's a renowned neuropsychiatrist from Hyderabad. He has been working as a consultant with KIMS Hospital in Kondapur and as an assistant professor at VRK Institute of Medical Sciences, mentoring many junior doctors. He received his medical degree from AJIMS Mangalore. He went on to complete his postgraduate medical, his MD in neuropsychiatry, training in Father Muller Medical College and Hospital, Mangalore, Manipal. His areas of expertise include mental health issues such as stress, depression, anxiety disorders, sleep disturbances, addictions, sexual disorders, behavioral disorders, and other psychological difficulties, including interpersonal relationships, stress management, etc. Dr. Charan is an avid public speaker and is widely covered in print and media for his expertise on mental health issues. He's active on social media and is happy to interact on his social media pages as well. So welcome, Doctor, to this webinar hosted by Felicity.
Thank you.
I also see, checking if we have, yes, and our fourth and final panelist is Dr. Rahul Lalit Hemani, who is a consultant psychiatrist in practice for more than 4 years now. He has completed his DNB in psychiatry from Tamil Nadu. He currently offers consultation at a clinic in Borivali. He is affiliated with the Wokhart Hospital in Mumbai. He has previously also worked with LTMG Hospital in Sion, BYL Nair Hospital in Mumbai Central, and Bhakti Vedanta Hospital, Mira Road. He works with child, adult, and geriatric population. He has a particular interest in the area of child mental health, de-addiction, and psychotherapy. Welcome, Dr. Rahul, to this session as well. So, to kickstart, the whole thing would be, we have some questions for you in the very beginning, and the guidelines are roughly 4 to 5 questions, which I will pose you all with. And we spend about 10 minutes. I try to moderate this so that every one of our panelists here, esteemed panelists, have some time with each of these questions. And we follow that up with questions that our audience, the people watching this live session, would also put up on our chat box. So I encourage all the people watching this session to please put up more and more questions, which I will then read out. So roughly for the next 30 to 40 minutes, it'll be questions from my side, and then we move on to questions from the audience before we close the session. Okay? All right. So the first question that I would like to start with, and we try to keep this as easy as possible to start with. We all know that this pandemic has taken a toll on every individual's lives, and one can't predict when we were going to get into some form of normalcy to a period what was before, or maybe it's a new normal. And this definitely has an impact on different age groups. So my first question to you all is, how and what are the signs or symptoms of mental health problems during this issue, which an individual can identify with, to catch it on early? So I'd like to start with Dr. Charan, maybe, if you could share your thoughts on this question.
Yeah. So good morning, everybody. Thank you, Mr. Karan, for introducing me very extensively, and also Dr. Sapna, Dr. Rahul, and Niharika. Hello. Yeah. So before I start, I don't want to freak out all the people who are, all the audience on the Sunday morning about what are the effects of pandemic on mental health. You might be trying to cope with it already because it's been good 6 to 7 months. But however, it's good to be aware of what can happen to our mental health. I know you must have extensively heard many webinars by now, but this one is going to be a little different because we have psychologists and psychiatrists coming together where we'll be helping with multiple different things. So we have never seen, I think at least in my lifespan, I haven't seen a pandemic. I've seen epidemics and endemics, but pandemic is first of its kind. We are also realizing what can pandemic do to our mental health. But forget about pandemic, any natural calamity, anything that happens suddenly and unexpectedly, when you have a lot of uncertainty around it, our mental health tends to take a toll. Few of the first warning signs that you should be aware of is, obviously you all know that it's called anxiety. What are the symptoms of anxiety? There are physical symptoms and psychological symptoms. Physical symptoms would be palpitations where you have racing heartbeat, shortness of breath, you feel choking sensation, dryness of the mouth, and your vision gets a little blurry. You might feel like you're going to throw up. You might feel lightheaded. You can have psychological symptoms, which is extensive worry and fear for health of yourself and for your loved ones. Along with this, you can also have mild changes in the mood as well, where you are having mood swings, you're having low mood, you're feeling irritable and cranky at probably on trivial provocation or maybe no provocation. Change in eating patterns, where you are either overeating or undereating, or comfort eating, we call it, emotional eating rather. We also have changes in sleep disturbances. I feel sleep is one of the main indicators for mental health. When that goes down, everything else goes haywire. So either you're oversleeping or undersleeping, or you have just day-night disorientation. You're sleeping all through the day and staying up entire night, maybe consciously by yourself, or probably you're working for different countries. All of this can happen as well. Some of us tend to cope up with negative patterns where we are smoking or drinking. This is also seen excessively, and this stress is also affecting physical conditions like diabetes, hypertension. People with cardiac problems are at definitely higher risk. Children are at higher risk because they're not sure of what's happening around them and they're cut out from the rest of the world. Older people are definitely affected because day in and day out they're told that you guys are not going to make it if you get COVID. So repeatedly hearing this over news, or people telling them, or their own children telling them, be careful, like you might not survive this, that itself generates a lot of anxiety. I think along with this, you can also see a lot of patients coming to me with inattention. They're not able to focus on their work. They're not able to focus on online classes. Interpersonal relation difficulties. You're cramming up the entire family in one one house, they don't have a social circle. They have to see each other every day, and already maybe there are pre-existing interpersonal relationship issues between the family members, so which are surfacing as well. So I think these are some of the effects on mental health that I'm definitely seeing. Okay. Thank you. Over to the next panelist.
Yes, Dr. Ms. Niharika, what do you have to add to this?
So essentially, I work a lot with terminally ill cancer patients, and I am seeing similar patterns in, lack of a better word, regular or normal, who are not terminally ill or who are well to do. So there's a lot of spiritual crisis and existential crisis among them also. So with this pandemic, some have been through COVID, some are facing the fear of getting COVID. So that has posed a great existential crisis, and I am having a lot of clients over various platforms coming to me and saying, hey, things are not working out for me, my schedule's gone up and down, and it's completely turned around, so I need help. And some people are here and telling me that I don't need help, otherwise I'm okay, I'm actually enjoying the time out from work. But you know what? There are a lot of issues. Now that I have time, I want to work on it. So while some people are scared, there are some people who are actually making good use of this time also. So they're working a lot on their mental health. And I am seeing at least some 10 people right now who are, sort of taking immunity boosters for their mental health in therapy sessions.
Right.
So there is a good mix. Fear is the key thing that I am seeing: fear of death, fear of dying, fear of catching COVID, maybe for their parents or for themselves. Isolation is one more thing. People are becoming more and more withdrawn. There are a lot of individuals my age stuck in different cities away from their families. So they are becoming more and more withdrawn, and they have stopped talking to a lot of people. So the communication is cut completely to the outside world. Some people are otherwise also very reserved and introverted. So their only communication is probably their classmates or probably their colleagues. So that communication, whatever they would speak in a meeting, is also sort of getting reduced in their day-to-day activities. So that has quite common for me.
Okay, thank you so much for that. I have a couple of questions to what both you and Dr. Charan just mentioned, but I'll save that for a little later. I'd like to hear what Dr. Sapna has to say to this question as well.
Hi, everyone. Yes, we have already heard about signs and symptoms. Most of them have been covered. So there are certain common things which I'm coming across as, when clients are approaching, or even, our friends and people around us in this pandemic are, coming up with. The most important thing which I'm seeing is the irritability and anger, is increasing with everyone. And also, the avoidance factor. Most of them are saying, no, there is nothing like COVID. And there are a lot of people who say that, no, there are other reasons also, people are dying. So why are we scared of that, right? There is boredom, which is increasing. Confusion is increasing. Decreased concentration we can see in people. Yes, detachment is also happening. A lot of people, depending on their personality, trait, people who were introvert are becoming more detached, and they are getting an opportunity basically to do that. The most important thing here is emotional exhaustion, which is happening, because yes, we are telling that it's a new normal. Yet this new normal, as we are, social animals at the end of the day, we are unable to cope with it. There was a time everybody used to say that, oh, I need my time, I need me time, and we really want to be, I hope I didn't have to go to office. I hope, I could work from home. But now everybody is looking forward to, when can we go out? When can we actually start working? They're asking their office people, can we just come in and join the office? When is it happening? In spite of the whatever fear they have. And one more important thing which is coming, there were a lot of people who had certain issues, in their subconscious or in their previous life, and in their childhood or when they were growing up. So the guilt factor, which sometimes they had, is, coming up to the surface as well. So they are looking for help. Yet I would say definitely a lot of people are coming to professionals now for looking for, help, which was a taboo some time back, most of them. And sadness is becoming a very important factor now because of the isolation and the social but when it comes to long term, if I talk about, we all know that job insecurity, the economy, how it is going, that's with each and everyone. Even if people who are in job or in their business, they are doing well, still that scare is with everyone. But yes, on the positive side, a lot of people have made lifestyle changes on the positive side of it. People have realized that okay, less is also enough now, which was not earlier, and profound adaptation has happened. People have started to look for more social supports, which was not there. Everybody wanted to be in their own zone, and they have started to take preventive strategies. That is very important. It's like, now they are aware. So,
Yes.
this is the change I'm seeing on the side where they need help and definitely on their personal improvement.
Thank you, Dr. Safran. I would like to now move to Dr. Rahul, but I have another question because the three panelists who spoke just now to address that question mentioned commonly certain attributes. One was irritability, anger. We have a situation where we have a loss of employment, jobs, an economy that's crippling back now as well, but that's already had an impact on a large population. In India alone, in September, we saw an improved unemployment rate of 6.67%. But in the peak of the global lockdown, we were talking in the month of April and May, 23 and 21% of unemployment, one of the highest we can even record globally. This leading to, like you just mentioned, the three of you just mentioned, anxiety, stress, loss of confidence, and not talking to people, increased dependency on alcohol, cigarette, other drug abuse, possibly just to kind of offset this feeling. But what do you advise such individuals how to help them cope with this issue? Especially with job loss related topics, which is very high today in urban India. And yeah, what's your tips for such people? And I'd like to start with Dr. Rahul on this question.
So, yeah, I believe the effects have been spoken extensively by our three panelists. And I believe that now that we know that these are the things that people are experiencing due to the pandemic, the things that what we can do is that the situation is already there. There was nothing that we could do once the pandemic started. The uncertainty, the fear was widespread and rampant. But what we can do is focus on the things that we can control. There were a lot of young individuals calling me up, telling me that, Doc, we have lost our jobs and now we don't know what to do anymore. Our families are dependent on us and our financial structure is very weak. And can you suggest, like, what can I do? I mean, that's what I told them, that see, there is no clear solution out of this. The thing that you can do is manage your finances, see what are the things that require your priority, prioritize whatever needs are there that need to be fulfilled immediately and those that can be done for later. Other than that, there are unfortunately less jobs, so maybe apply for something else, try to gain another kind of a job, which again you might be not very comfortable with, but at least it will get your ends to meet up at least. And the priority, as I said, is that don't focus on the things that you can't control. There are two things in life, very simply, if we divide them into things that you control and things that you can't control. And the more you focus on the things that you can't control, because that's how the human mind works, you kind of start feeling more and more anxious, despair, fearful, and that's where you hit rock bottom. And then you start consuming drugs, alcohol, smoking, because you just feel that you're out of control. And that's when even the existential crisis kicks in, saying that what is the purpose of life? If life was supposed to be so bad, there were so many individuals calling me up and telling me that it's better that the COVID would have affected them and they would have just, passed away with that. And I was like, this is just one test of time that you're facing, and it's not going to last forever. It's right now that you need to be strong in this. So apart from that, I think if any kind of anxiety or depression that an individual is facing, I believe that yes, sessions, and fortunately, the one good thing that has come out of this pandemic is that mental health is being propagated, and people are being speaking about mental health very commonly and very openly. And especially after a few debacles that happened in, like, the suicide debacle, and those things have really kind of made people aware that yes, this is something that they should do on an immediate basis. And very fortunately, one more thing that has happened is that mental health services and psychiatrists and psychologists together have been providing services quite a lot of times even free. So I don't think that accessibility is any more a problem, because fortunately telemedicine is available for all of us. So I've seen a rise in the number of people consulting me, and I kind of end my day now beyond 12 also sometimes, considering the online consultations and all. So I think what people can do facing anxiety, depression is immediately consult a mental health professional. They will be able to guide you in the right manner rather than asking your friends what to do, and they might give you some kind of suggestions which might lead you down on a difficult path unnecessarily.
Yes. On that note, I'd like to direct the same question to Dr. Sapna.
Yeah. Yes. So Dr. Rahul has covered a lot, and definitely that's what everybody should get into. From my side, most important thing I feel is share. Share is very important. So when I say share, share stands for me, it's like see it, hear it, are you feeling it, report it to someone, and then embrace the change which is happening. Yes, we all are going through a lot of changes, as we are talking about. Job changes are there, and some of them have lost job. Yet it's important for us, when we share, we do come to know that's a very important part of it, that okay, I'm not the only one. Because first thing comes when we feel low is, why me? That's where everything starts. So when we look into all those, we definitely come to know at times, little strategies from each other also, that it's not me only coping with this. Like right now, the fear when it started of COVID, everybody was really, really scared, and the panic was there. Now, as in when we have come to know, it's not only my colony, my street, my country, it's the universe. We are still okay that I'm not the only one going through this. So
Yes.
that gives us that, yes, I have some support. So from my side, it's like, I always tell them, yes, definitely share it, take whatever support you can. Yet look at it that what you have, life will have all kind of changes, roller coaster it is. We'll have today this problem, maybe tomorrow, even if when we will get the vaccine, maybe there can be another challenge also. So we have to actually start to learn to cope with our problems, and see that whatever resources we have right now, how we can utilize them, take the support, and go on. That's what it is, and that's what I feel a counselor's job is also to, it not give them tools to do that, equip them to always cope with whatever situation comes in. So once they have that, they can go on with that. So important is they should really look at their problem, share it, and look for solutions with it. That's important.
Absolutely. This brings me to the next question, and this is actually you spoke about awareness, and in this lockdown, or let's say this global lockdown, starting off mid-March onwards, there was this spike or increased dependency of getting information from social media. And this is also another form of awareness for, like you mentioned, right? So for people to connect. And first thing we do today is we go online and check for information, whether be it mental health issues or how can I connect to someone virtually, just get help. But this also leads to a lot of misinformation that's circulating today, and we have a staggering number of false facts that circulates, adding to the anxiety, adding to the fear. And I would like to know, Ms. Niharika, to start with you, what's your take on this impact that it has or adds to the mental health issues that we face today?
Okay, so I have clients complaining to me of feeling hopeless, helpless, anxious, and even cynical of whatever is happening around the world. Even a good news comes and they're like, oh, this is just I mean, there's no point in this, the pointlessness of everything. So, social media is definitely adding to the pointlessness, the worthlessness of whatever people are doing right now. And they're like, I'm working so hard, I'm studying so hard, but I won't be able to give exams. So, and then the exams are getting delayed and pushed because of whatever political reasons. That's a different matter. But that is again and again shown on the TV. So it's getting difficult. A lot of people are spending time on social media with different challenges, like a sari challenge, this that. So people are having like I have a client who's complained self-esteem issues because she was suffering through sadness and she put on a lot of weight in 2 months, and then the sari challenge happened and she saw all her friends wearing saris and putting it up on social media, and she had a major breakdown. So apart from whatever is being telecasted on the TV, Instagram and Facebook with all these challenges are adding a lot to the mental stressors, and even body image issues and everything. The sleep is getting affected. People are working all throughout night and around social media late at night. So sleep is getting affected. The entire circadian cycle is gone for a toss.
Yes, and like you mentioned about social media dependency and how it has impacted the public at large. We also have the right information, and we have this whole false facts that we also get online, and huge volumes. And it's so easy to fall under the false facts concept in this disturbed state. So I'd like to now move to Dr. Charan. Dr. Charan, what's your take on how can we or how can an individual try to get the right information and not get an overdose of that as well, so that it doesn't add on? What's your advice to an individual in this particular scenario?
I mean, to be very honest, I wouldn't lie. In the beginning, even I was obsessively checking what are the statistics, around where I live and also my family who is abroad. That used to kickstart my day on a very terrible note, and that I used to carry that to work and then back to home, and it used to leave me frustrated and sleepless. So I learned it the hard way, like 1 or 2 months later, to not check news because if anything substantial I have to know, I will get to know. But as a doctor, I have a responsibility to understand what's happening and what are the rates of mental health issues or physical health issues. So I do have to check. But if it's not an occupational hazard for you, I suggest you to go off news. There are two kinds of news. One is a neutral, positive news. Another is definitely your tabloid news, which comes at 9 p.m. right before you go to bed. So that has to be definitely avoided. Having a news time will definitely help, which shouldn't be right after you wake up, because we all have nasty habit of reaching out for our phones and checking out. That sets us on a wrong mood. And even before you go to bed, the entire family sits and they watch together, including kids, which is again not good as well, because they are announcing it loud and clear how many people are dying or were affected, and it's no good news. It's all bad news. So, along with a pandemic, there are also pretty negative things happening in the recent with the caste system and violence on women and etc. So nothing is positive. I'm not asking you to turn a blind ear, deaf ear, and a blind eye to it, but I think personally having news time somewhere in the late afternoon or early evening can help, but only for like 10 to 15 minutes. After that, your alarm should ring and you should stop checking, because we are very curious people. We tend to go from one block to another, one column to another. So that we have to stop. So 15 minutes, get your daily dose of what's necessary and then stop it. Also, people who are sending a lot of WhatsApp forwards, I have muted a lot of people, a lot of friends also, a lot of groups that I was forcefully put on because it's very negative. But there are positive effects of social media as well, because in the time where we are not able to socialize, where we are, shut down in one house, social media is the only channel or outlet for us to connect with people and see what's happening. So I have unfollowed a lot of negative people, and I've actually started following a lot of positive pages. Also, health relevant channels like CDC, UNICEF, WHO. They're also doing pretty amazing challenges. Like Ms. Niharika was telling, even I have done a 30-day mental health challenge, which is just great fun. So you can do these challenges, as long as you're taking them in a positive note without comparing with other people. You can do all of that. Yeah. So there are both downside and upside of social media, like any other thing, but you have to choose what overwhelms you or what keeps you happy.
Absolutely. Dr. Rahul, would you like to chip in on this?
So I think yes, spot on that, Dr. Charan. So what I would like to add on is that for the first time ever, there have been new screen guidelines that have come across, because suddenly in this pandemic, people were using their screens excessively, and not just adults or just the youngsters. I would say even young kids in the in the school going age group, because they did not have anything to do. The parents are obviously tired of them fidgeting around trying to go out and things like that, so they just handed them their phones, their tablets, and just go on and watch whatever you want to do. And even elderly, I mean, for the first time ever, I've seen elderly individuals beyond 60, 70 years feeling extremely comfortable using a smartphone, calling their friends on WhatsApp video calls and things. And that was a pleasant delight to a certain extent. But then the excessive use started obviously hampering their day-to-day activities, their social connect inside the family itself. I mean, this was the first time that families got the chance to sit together and socialize with themselves. But still, the same thing started happening. And not just that, social media, as already has been said, is a double-edged sword, as you can see. On one side, where it's giving you so much positive information, it's helping you gain knowledge. At the same time, it unnecessarily scares you. As I remember, after the suicide thing that had happened, there were a lot of phone calls coming across, because a lot of very horrid pictures were shared on social media, and people were extremely scared after seeing them and calling and saying that, what if something like this happens to me as well? And explaining them again about it, telling them that it's something that it's a different trajectory for everyone and nobody is in the same direction, was very difficult. Also, one thing that was spreading across the social media were the names of the medicines that those
Yes.
public figures were taking, and those kind of things also scared a lot of people, because they started calling me and saying that we are also on the same medicine, so what if something like this happens again to us as well? So, as I said, social media has been helping a lot, but at the same time, just we need to know how much we need to consume and how much not. Because there is a theory of harm reduction where you can classically understand what is harming you and how much or when you should stop. So, suddenly, when something like this comes across, a lot of people say that stop using your phone suddenly. And I think that that's impossible, obviously. When you suddenly do that, I mean, if most of the people would have watched a very good documentary that has come up recently on Netflix, the Social Dilemma, they've understood that what social media is doing. You don't stop your online usage suddenly. You make a balance between your offline world and your online world. There is a concept of even social diet, where you understand what are the things that you are supposed to consume, what are the important ones, like for example, video calling a friend when you are suddenly very emotional. It's so easy now, but at the same time, video calling a person every other minute, just because you're feeling that you want to just see the other person all the time, is going to be again very harmful too. So I think we need to just create a balance between what we can and what we should.
Very true. And just to put in my two bits here is our social calls now with our own family and friends is once a week, and we have no more group pictures. The group pictures today are Zoom pictures, the screenshots that we take. Um, it's got its positives as well. At least this was early on in the lockdown. And like you mentioned, there's a lot of negatives, so we need to pull in a balance. Very important thing that Dr. Rahul, you and Dr. Charan mentioned a little while ago was the impact on children and adolescents. So this COVID-19 has brought a lot of, it's not only adults, it's not only about people who lose jobs. There are different people and different age groups which have been impacted by this very largely. And for children as such, the impact of closure of schools, of educational institutions, of being able to gather together with their friends went a long way, right, in their development as well as impact on their mental health. And today they are constrained to being at home, having classes online, which also is a lot of challenge, not only for the kids, but also for teachers, for educators, for parents at it. And here the question is, how can we address this mental health impact on children and adolescents, especially also tips from your side for for parents who have to deal with this as well, and educators who have to deal with this. So I'd like to start with Dr. Niharika on this one.
Well, unfortunately, I don't work with children, so I can only hypothesize and say what can be done. So my tips and techniques won't be as efficient as I think Dr. Sapna has more experience working with children than I do. So there should be definitely a balance between the screen time and their play time. Probably create so if they have a building or if they have immediate best friends who can have 3 or 4 families who are healthy and they know that my family is safe, your family is safe, they can actually mingle and study together or play together. So interact in that way. I think that would be quite beneficial when it comes to children and even adolescents for that matter, because when it comes to adolescents, they're also working, or even children, the social play, the social interaction is actually molding their personalities, molding their approach towards the world. And now that it's kind of shut off, their identities and their grooming will be stunted somewhere or will be lacking somewhere. So, if not the entire class, maybe a 3 or 4 people from the class who stay close by or who they can interact with. And the same can go with the parents also. So just talk with each other, share, support each other throughout this process.
Right. Yes, I'd like to move to Dr. Sapna, being a specialist on child counseling and adolescents as well. I don't know if you missed the question, Dr. Sapna, but this was related to the impact on kids' mental health, children and adolescents, the impact on their mental health during this pandemic and lockdown due to closure of schools and educational institutions, not being able to socialize. So what's your take on how do we address this and tips for parents and educators maybe?
Yes, it's a very, very important thing which is happening because, see, as adults only, we are going through a lot. And for kids, it's totally a new situation where they really don't know what has to be done. Even parents don't have answers for this. So it's important for us as parents, being at home, to be very, very observant, first of all. Because children are earlier also, it was the screen time, and now the screen time has increased. But yes, we are always talking about, in research also, it's been shown that, parents in one day, on a minimum average of time, they say, about 150 times no to their kid, you know, for everything, that don't do this and don't do that. Yet we are unable to say what they have to do, basically. So here the role of a parent becomes very important, first of all, as a role model. When the parents are on their own, on the phones or screens or anything, most of the time, whether it's a television or something, wherein we cannot tell the children not to be there. Also, definitely, because they do not have any other exposure, the social part is missing, they are unable to go to school, so they're already going through a lot. And because of the classes are online, so they are putting maximum pressure right now because they also have more time with the kids. So it's becoming a more tussle that they should be doing something constructive. That's becoming very important for the parent. Oh, the child is sitting free, but they also need their free time. So that's why I always suggest the parents that give them some free time, means they can do anything and everything. Definitely not only the screen time, but give them some time to do, even if they are just sitting and playing with a cardboard, doesn't matter. But
Right.
it's a free time which is required. All the time, the supervision at home is increasing. Most of the time, parents are there. So from here, dadi is telling something from their father, is telling something from their mother, is telling something. So that has to be also restricted to an extent. And definitely, a schedule has to be created. And it has to be a family schedule, a new normal schedule, wherein now nobody is going to office or schools. So how do we create that, timely sleep still, should happen? Late
Right.
nights should be avoided, timely. How many hours of sleep is required? That is very important. So to sum it up, role modeling is very important. How much control they have to do is important. How much supervision has to be done, that is also very, very important for them. And yes, some opportunities given to them, what kind of indoor games we can introduce to the kids. And we also give them quality time. Not generally, people feel, or parents feel, that if we are sitting together and watching a movie or a match together with the child is quality time. It is not. If you want to create it as a quality time is interaction. When there is interaction happening while watching a match or even watching anything, then it's a quality time for the child. Not that everybody is sitting and they are just quiet and watching any program for half an hour, 45 minutes. So now parents' role become very important for that, that they have to also create a peaceful environment, because everybody is into lot of stress because of their work as well, work from home, they don't have even workstations, so a lot of stress among each other in relationships is also there. So children are so much exposed to, irritability, which we were talking about. How a parent, one partner is talking to the other partner, and the anger comes on to the child. If the child comes into the picture, the whole anger goes to the child. So
Mhm.
it's a role of a parent to create that peaceful environment and model that behavior right now.
Right. Thank you, Dr. Sapna. Rahul, I think I've also read in your biography you also specialize in this area. I'm sure you handle such cases as well. What's your take on the same with children and adolescents? What's your tips for how they could deal with this impact?
So, on to start with a positive note, I would like to say that this pandemic has given the parents a chance to, reconnect with the children. The parents who were working throughout their day, coming back home late, the time that they did not get, even now that they're doing work from home, they can at least be with their kids. I mean, I had a lot of fathers coming along telling me that on one desktop they were doing their work, on the next desktop side by they were sitting with their sons and doing so they felt very connected even though they both were into something social media. So that way the connection has improved a lot. But at the same time, as Dr. Sapna was telling, that the more time that the kid has been inside, the parents have started getting a little irritable themselves, and they take it out a little bit on the children. Sometimes the parents themselves are fighting between each other, and those kind of tensions are kind of getting on to the child. So basically it goes against the nature of a youngster or a teenager to sit inside. They're supposed to be taking risks, they're supposed to be going and playing, exploring the world. And when that is not happening, it's but naturally going to increase any kind of mental health stress that they could experience.
Right.
So I think, yeah, that's
Yeah.
all about it.
Thank you so much, Dr. Rao. I now see that we have our first question in, and I'd like to read that out from our audience. And so here goes. Sometimes it can be a little hard to share how you're feeling because you know everyone is going through the same thing. And you don't want to overwhelm, burden, or gaslight anyone. So, what would you suggest are the ways that we overcome this to reach out to people and still talk about issues that they're facing during this hard times? So, I'd love to go to Dr. Charan to start with this.
Yes. See, different people have different ways of expressing what they feel. Some people like to talk to others. Some people like to talk to themselves, give that pep talk to self. Me personally, there's no right or wrong way to do it, but I don't really go and discuss my problems because I think they are manageable by myself. So what I do is I do a lot of art. That's a way for me to express what I'm feeling. Um, Journaling really helps. There's something called reconstructive journaling where you're not sitting and writing your entire life biography of I woke up at this time. You don't have that kind of time. So you can write. You can probably have 5 things to do your daily chores for the day, and maybe like one thing that you have never tried before that you're going to try that day. And
Right.
at the end of the day, you have to review if you're able to do all of them, or if you didn't, what is the reason, what are the roadblocks, what are the thought blocks for you to not achieve the goal. That can help. Another way of reconstructive journaling is if you're getting a repeated negative thought, you're going to write the thought, strike it off, and turn it into something positive. For example, my initial thought was, my mother is sick. She's hypertensive and she had a spinal surgery. So I was really worried that, because I'm a doctor who goes into ICU and post-op wards and emergency rooms, etc. There's a very good likelihood that, I can bring infection home. Um, so that really scared me quite a bit. So what I did was I used to write down that my mother might get infected, and then I used to strike it off, and I used to write that no, she will be fine. But later it felt to me that I'm actually kidding myself that because there is a good chance that she can get infected. I can't just strike it off and write. So I started writing what are the other possibilities that can happen to her. So I started writing from most optimistic to the least optimistic one. The first one is she will not get infected. Second is even if she does, she'll have a mild infection that can be managed at home by quarantine and simple meds. Then even if she is having moderate disease symptoms, she'll be in the hospital but in a room, not in ICU. Last is obviously she'll be on ICU and ventilator, but she'll come out fine. When I start seeing this, when there are 6 outcomes that can happen to her, in all out of 6, all 5 areas, she's coming out healthy and hale. So that gave me a positive reinforcement that okay, she's going to be fine. There's only there's only little chance that she might get infected. So that gave me a lot of confidence, and I started feeling better. So you can express your feelings in a different way, and fortunately, there are a lot of online counselors that are available for you to talk, and there are friends, people who have good social circle. You all can talk it out. You all can do some bonding exercises together where me and my friends who are doctors, like, we started cooking the same thing. We made a dessert recently, no bake dessert, and we all did the same thing. We were on Zoom or Google Meet, I think. We were all talking and making fun of each other, remembering our old college times where we were horrible at cooking. So we finally baked something and it was fun. So there are different ways for you to express, not necessarily talk, but definitely talking is the first thing. I'm not minimizing it, but there are other ways as well. So you can do all of this.
Yeah. Dr. Niharika, do you have anything to add to this?
So I support talking. So it need not be to a therapist. It can be anyone. So peer support and other sort of guided support groups really help because it gives you that sense of connectedness that I'm not alone. I'm not the only one feeling this way. It's okay to not be okay. It's really okay to not be okay. And when you are in peer support, you realize that there are other people, if not the same, but similar. And that gives you that sort of validation or assurance and support to sort of deal with coping strategies. Because while I don't know how to cope with a particular situation, there are 3-4 other people who are doing that. Mm-hmm. So we have you. So right now the issue is we are all working from home, and so we have started having meetings on Zoom, and we do supervision or support sessions for the organization's therapists. So even the nurses join us, even the doctors join us whenever they can, and we are trying to deal with, because we deal with a lot of dying people. And right now, before we would go out into their homes and then speak with them. So when we come back home, we are able to keep our work life and personal life separate. But right now we're talking to dying people from home. So my environment, my study, my living room is becoming toxic for me. So those peer support groups have really helped us cope with, manage our own helplessness and our own anxieties related to the work and related to the pandemic. So support groups really work.
Thank you so much, Ms. Niharika. Another important question that I got from one of our audiences is requesting us to talk a little more about how the pandemic has affected relationships and what can we do to make our relationships better. Because now, there is a rise, and this has also got, let me call it has impacted on the topic which one of you mentioned a little earlier in terms of increase in violence as well. But before I get to that part, just let's talk about the question that the members asked over here regarding how it has impacted relationships and what could be tips that you all could give us today to address this. So here I start with Dr. Sapna.
Yes, definitely relationships have been affected the most right now, because everybody is under one roof and suddenly everyone has a lot of time and they don't know how we have to actually utilize. And especially the relationships which were vulnerable are becoming, more on the verge of, anger and tolerance, because again, work from home has already put a pressure. So it's like professional pressure is already increasing, and there is another new thing which is coming from the personal front. I would suggest the most important thing which everyone has to keep in mind is the communication. As we know, communication is the key to any relationship, professional or personal. So I would suggest there are two keywords which should not be used or as less as possible, which can actually harm any relationship. And those are always or never. Generally, when we talk to our partner and we have to share something, we say that you are always doing this, you are always keeping the things, untidy, or you never help me. As soon as we use these two words, the other person who's listening to us, they block the responses as they feel that I'm never being recognized, and even right now I'm not being acknowledged for anything. So why should I do anything? So that's where the communication stops. Second most important thing is whenever again we communicate, we should use the words how, when, what. We should not just say it in a very generalized manner. We should always say that yesterday, when you actually did not do this, it impacted me in this particular manner. So we are very specific in our comment or statement. So these generalized statements basically bring in lot of vagueness, lot of questions in the other, person's mind. And as maybe the other person, other partner, whosoever it is, may not like to go to into dwell it into. Many of the partners have said that I have learned the strategy that okay, if he or she is talking or if he or she is furious, I'm not going to talk about it because I don't want to aggravate. Yet it remains there. Now, to avoid that, if one partner is talking about very specific statement, how, when, what, so it gives a lot of chance for the other person in understanding the partner. So I would suggest that to improve on relationship, utilize, first of all, utilize this time to work on your relationship if it was not. Yet on the positive side, I have also heard that people are utilizing this time and their relationships, which were little weak, the time has really helped them to heal.
Yes.
So I would just, sum it up here and say that please work on your communication and take these tips, and definitely it's going to help you out.
Thank you, Dr. Sapna. Dr. Rahul, do you have anything to add here?
So, to begin with, I would like to just say that pandemic or no pandemic, relationships have always been important. But the one thing that this pandemic has made us realize is how much we value our relationships with everyone. So I think before we start working on the relationship, the one thing that that I always suggest when a person comes to me, and to be very honest, it's not just a relationship between a boyfriend or a girlfriend or your fiance. It could be a relationship with your brother, with your sister, with your parents, with your friends. I mean, it can be any kind of relationship. So first, evaluate your relationship. Like, what is your priority in the relationship? What do you look for in the relationship, and what is causing the friction in the relationship? Ask yourself these questions. I mean, what is more important right now for you rather than the relationship? And you get the answers automatically. You realize that this is how much you want to do in the relationship. And then most importantly, communicate that with your partner, whether it's, as I said, anyone, whether it's family or a relationship like a boyfriend or a girlfriend. Because this pandemic made the close going couples suddenly separate out. Even in the same city, if they're staying at two ends apart, they were unable to meet. And how much will a video call be sufficing for them then? Yes. So that made them realize what this relationship was exactly. So I think in a good way, you did realize that whether this was something that you wanted in the long standing or not too.
Thank you so much, Dr. Rao. I was just going through the list of questions that we have. We have one more where I think it's a very good one as well, where we spoke about children and adolescents a little earlier. And the question is related to the parents. They may not be 100% okay with their children getting therapy when required, because we still have a stigma attached to getting social, like getting therapy or going or visiting a psychologist or counselor, especially for their kids. So, what do you think should be done in this case? That's one of the questions that I just received. Ms. Niharika.
So what to do? I understand the stigma. It's been there for a very long time, and it's going to take some more time to break through it. But it's okay. I mean, it's okay if your children can't communicate with you, probably because they are fearful of saying something wrong and then you scolding them. So if it's a third person, so if they are closer to their cousins or something like that, my cousin confides in me. She doesn't speak with as much me. She may not speak as much with her parents, but she confides in me. So it's about identifying a safe person to so that they can speak, and because that helps them. That really helps them, and Dr. Sapna can add more to it.
Dr. Sapna?
Thank you, Niharika. Yes, it's very important for us to understand why do we go for a therapy or to a counselor. It's very, the main thing I think people want to go to a counselor or a therapist is you are going to get an unbiased approach. Here, nobody is going to judge you. That's the most important part. And parents must realize that, definitely, especially when we talk about adolescents, they really do not want to share their own things. Yet they want to. It's not that they don't want to. So if they go into a therapy or a professional, so definitely, they can make sure that the child is able to share and get, a confidence wherein he can share his problems and a solution can also be there. And also now with, I think it's very important for all of us as therapists also to create this awareness among, around us that yes, we all should start looking at counseling or therapy, not just that, earlier as a taboo. It's just like you are taking any therapy, or any treatment from a physician, so it's practically same. The best part right now, I feel, is earlier it was extremely difficult for parents or anybody to go for therapy because it was a face to face thing. And, even entering that somebody will see me, I'm going to a psychiatrist or I'm going to a psychologist. Here it is in your bedroom or in your office. You just switch it on and you are with your therapist. That's the safest part of it. So I think that would also help. So definitely awareness is one part of it. And as parents, we should also make them understand, or maybe we can also start with talking to the parent first and give them, that kind of comfort. And once they feel comfortable, they definitely would like to, find solutions. At the end of the day, they are looking forward to solutions only for their children.
Okay. Thank you so much, Dr. Sapna. I move to Dr. Charan now. This is a question which says, I agree that therapy will help to some extent. However, the flip side of that can deprive an individual from thinking on their own and increase their dependency. Please clarify. I repeat, if you didn't get that, I repeat. I agree that therapy will help to some extent. However, the flip side of that can deprive an individual from thinking on their own and increase their dependencies. Please clarify.
I mean, unlike West, we don't go to therapists to talk about our everyday problems. If there is a small fight in your house, you don't go. I mean, which is, I think, is very helpful. But still, we don't go. We only go when the problems really hit the roof. Only then you go. Also, in therapy, the therapists are not going to solve your problems. They're not going to tell you like, do this or don't do this. They're going to facilitate your own thoughts. I mean, to my knowledge, this is what they do. They make you think on your own. They help you reach decisions or conclusions by your own. So what they show in movies is not what therapy is. It's not the typical couch and you lie down and or you go to a beach and talk to a counselor. None of that. You're basically somebody facilitating you to reach find your own solutions for the problems. I think that's what they do. So I don't agree with that. That happens. Also, it's upon you as a person, right? I mean, are you going to completely give away your thoughts to someone and let them decide for you? No. At the end of the day, you are a person of your own. Even though if therapists insist on you doing something, it's up to you to do or not. I mean, your logical brain is still intact.
I think, thank you, Dr. Charan. I'd like to move to Dr. Rahul because this would be the last question. And Dr. Rahul, this is the same question, but I'm just going to extend because there's one more question kind of closely related to this and it's very brutally blunt. It just says, does therapy really help and how? So I know we've answered this to a large extent, but since this question is still coming up, maybe you could wrap it up from your end by addressing this particular question, in addition to what Dr. Charan just mentioned.
So, to begin with, I would just like to first say that yes, Dr. Charan, you are right about the couch thing, but guilty as charged, I do have a couch in my clinic because I was quite, impressed by that way the room is supposed to be, and I always envisioned it, particularly the point where when I realized I wanted to become a psychiatrist. So I do make my patients and clients sit on the couch and ask them to, speak comfortably on whatever they want. And to be very honest, just answering the first part of the question, there are a lot of still people who actually do come to me and then just sit down and recount their, weekly activities, their monthly activities. And they literally tell me this, that doc, we have not come for a specific problem. We have come because we wanted to speak in a safe space. And I think that is what is, taking care of your mental health, allowing yourself to talk to however and whoever you want to do. Because unless and until you are not going to feel confident in what you are talking about to your friends or something, you won't be able to express them freely. And that is where a psychiatrist or a psychologist, basically a mental health professional, plays a role in. Coming to the second part of the question, I think, see, I know most of the people call therapy as just talking. They come and tell me that how, I mean, there have been a lot of people bluntly asking me that, doctor, how just talking with you is going to solve situations. And I told them that, see, I'm not your neighbor or your to understand your thought processes. I'm going to exactly understand the negative distortions that your thoughts has right now, and that is the reason why you're thinking in a negative manner. For example, there are these cognitive distortions like overgeneralizations, personalization, maximizing, minimizing, those kind of things that over a period of time, because we are in the sad mood or anxious, we kind of keep on looping on them again and again, and that is what aggravates our problem. So I believe that therapy plays an equal and important role in along with medications as well, because unless and until you don't guide a person out of your problems, they are not going to come out of it. In simple analogical terms, I usually give this example where I tell them that, see, medicines are like petrol to the car, that we are going to fill up the petrol in your car, but eventually you are going to be the driver and we are going to guide you on the route on where you need to go, but we are not going to tell you exactly where you need to go on the left side, on the right side, when a crossroad comes. We're going to be just there with you and help you decide what already is there in your mind, because you already know the answers. It's just that right now you are unable to clearly define what you need for yourself, and you just need help in guiding that. Like, a lot of people or youngsters come to me saying that I broke up and I'm not sure whether I should be doing that or not. So we don't tell them to get back into the relationship, or it's no, it's good thing that you broke up. We tell them that what is it exactly that you are looking for in a relationship, what are the pros, what are the cons, what are the things that eventually you're missing out on, and they themselves come up with the answer later on in about 3 or 4 sessions that, yeah, this is what I was looking for, and I got my answer. And a lot of actually patients, whoever, if probably someone listens to later on, might even complain this, that, doc, you never give me the answers. I keep on asking you the answers, but you keep on telling me that you are going to get your own answers. So I think therapy helps a lot. Please don't feel that because of a few misconceptions on social media that therapy is just talking, and you're paying so much for just talking to some random individual. It's absolutely not that. Please feel free to experience therapy once, and then you'll realize. I think among my patients, whoever have come to me, I have never heard a complaint from them in regards to this part, ever.
Thank you so much, Dr. Rao. We have so many questions, and I couldn't think of another way to wrap this up with the way you just did. So thank you again for that. Unfortunately, we've already overshot our time, so I'd like to wrap this up now. Despite me personally also not having all my questions answered, and thanks to this riveting session that we just had, I'm waiting now already for the next webinar. So, Felicity was created with the idea of connecting professionals in the field of mental health and people together to make a world a happier place, right? And we follow the motto, talk, resolve, and heal, encouraging people to talk about their feelings to feel better. And Felicity consists of a vast pool of professionals, including our current panelists, Ms. Niharika and Dr. Sapna. and our specialists or therapists are available 24/7, and you can book a session with them in just 5 very simple steps. We urge you all to also please follow Dr. Rahul's and Dr. Charan's social media pages for some tips and live sessions. We have them in abundance, easily available as well. And as mentioned at the start, this is just the beginning, right? And we will be conducting a webinar every week. So please send in your suggestions, your ideas, follow our social media channels. To know more about the company, please visit our website, www.felicity.care. That's www.felicity.care. And once again, I would like to thank all our panelists today for taking time out on a Sunday, joining us here, giving us very important pieces of information, tips on how we can deal with it. And once again, going by the name, Ms. Niharika, Dr. Sapna, Dr. Rahul, and Dr. Charan, thank you once again so very much. And for the audience, thank you all for encouraging us. And it was lovely having you all here. With this, we will be wrapping up our first webinar. Hope to see you all soon. Stay healthy and stay safe. Bye-bye.
Thank you, Karun.
Thank you.
Bye.